Welcome to our weekend wellness hour. Happy Sunday. And this morning we have a new friend of mine. I met her through wonderful Suzanne Gray, who was on a couple weeks ago. And Dr. Nidia Diaz has amazing background and story. And I'm excited to share that with you today because she has spent 10 years traveling in Asia and Europe, learning some of the lesser known methods of healing. And she began in acupuncture and traveled all over 25 foreign countries and apprenticed with healing masters, including Yeshi Dhoden, which I don't know if I said right, who is a personal physician to the Dalai Lama. She also gained a certification in medicinal leech therapy, which we're going to talk to you guys about today because I'm fascinated how we use leeches, and I'm curious on what she has done with people because I've heard that she's had amazing results. So she is only one of a handful of physicians outside of the emergency room practice that can use this method, and she's certified to do it. So I want to welcome this amazing person, Dr. Diaz. Thank you for joining us today.
Thank you. It's such an honor. Thank you so much for having me. I appreciate it, Amy. You're awesome. Thank you.
Thank you. So we're curious. Why don't you tell us a little bit about your background? Why did you decide to go over to Asia and Europe, and kind of tell us a little bit of your story?
Well, I grew up in New York City, and I was always intrigued with Chinatown. Okay. And, the whole Eastern secret sort of, lovely, fascination ever since I was a child. And also just feeling like there was a calling ever since I was a child to be a healer. Massaging my dad's feet every night probably, gave me that sort of like healing touch, and so to speak. Mm-hmm. So I went to FSU and was planning to go get a marketing degree or, something like that. But I did. But I had an experience where there was a dog that I had some sort of energetic healing experience with, which led me to, discover what Reiki and energy medicines like acupuncture really consisted of. And it intrigued me, and it set my world on fire that I needed to know more. So I graduated from the second oldest acupuncture school in the United States here in Pinellas Park, Florida Institute of Traditional Chinese Medicine. But when I got out, I couldn't get a job because I had to even explain to people that, for example, I tried to get a job at a chiropractor's office. They said, we don't believe in that voodoo. So we're Christian. We don't believe in acupuncture. I'm a Christian, acupuncture has been used for thousands of years, non-denominationally, Mm-hmm. Yeah. So I was inspired to go to Asia after having a breakup, new life. I was like, okay, let me just go and discover, these beautiful ancient medicines around the world. And what I brought back was the leech.
Wow. So what are all the countries that you went to, or some of them?
Well, over 25 foreign countries, mm-hmm. living out of a backpack, essentially.
Wow.
Hostel to hostel, searching for the most renowned healer mm-hmm. in remote areas and learning different techniques. So from Moscow to Malaysia.
Fascinating. And these are what you're studying. How did you find them? Did you just start asking people? Did you research it ahead of time and go from one healing art to the next and see which one resonated with you? Or how did that all process work?
I believe it was just more following my intuition. Yeah. And going with that feeling that there was a sense, a purpose that was guiding me.
Okay.
And so I would, for example, the Snow Lion Mountain Doctor is renowned in National Geographic editions since the 70s. I wanted to meet him. I'd read about his, amazing pulse diagnosis and incredible mountain herbs that, cured so many of these European travelers that went to the secluded mountains between the border of Tibet and China. So mm-hmm. there were practitioners like that, or the personal physician to the Dalai Lama, renowned healers that, are commonplace. But I enjoyed the most was finding not so much famous healing practitioners, but people in the community that just did this every day and had lines out their doors, that were just, what locals claimed as really good medical practitioners or healers.
Wow. Mm-hmm. Yeah. Did you
So yeah.
try any of this yourself?
Yeah, of course. Of course. Of course. Yeah.
Yeah.
So,
That's amazing. So what country or where were you that led you to leeches?
well, I had sort of wondered about it when I went to India and saw that the Indian god of medicine, Davantari, had 8 arms and one of them was holding the medicinal leech.
Okay.
So it wasn't until after a much further time. I mean, it was really when I had a patient that was not responding to any treatment that I could figure out. I did bloodletting, I did, traditional acupuncture points, electro, e-stim, but his case of hemorrhoids was terrible.
Mm-hmm.
And so I, looked on the internet, thank God for Google. That's really, what confirmed my interest in it, was that it was the tool that they used as, the original surgeon.
Really?
And he didn't want to get surgery. And it was, typical blood stagnation, a knotted vein, hemorrhoid sort of condition. And took a chance and basically was screaming when I first put on my first leech on his tailbone, just his tailbone.
Really? Oof.
And now I know that it was so effective, just one leech, because the leech saliva can penetrate 3 inches deep into the body.
Oh my gosh, that's far.
So yeah, even though it was crazy and I was screaming to the top of my lungs when I first, not in front of the patient, but when I first got the leech out,
Mm-hmm.
hello.
In your head?
Now I put them in my mouth. I put them in my eyelid.
Really?
I pretty much put them everywhere, like it's an amazing transformation of fear to, just fascination.
So, okay. So first, does it hurt? And can you feel anything afterwards?
So my patient as well did not want to get surgery for his hemorrhoids because he had some anxiety over it. Mm-hmm. So I convinced him that, reading up on leeches, how many people get leech bites in a pond, they don't even realize it until they get out of the water, because they have a very strong anesthesia. Super strong anesthesia. Over 100 different biochemicals in their saliva.
Oh, wow.
So it is also considered the little pharmacist.
Got it.
And in Moscow, where leech therapy is much more common in practice, you can't get more than 5 leeches during one session and be able to drive home.
It's that strong.
It's that powerful because one of the drugs being the most strongest anticoagulant on the planet, 8 times stronger than heparin, they say. So you're getting a rush of life.
Wow.
I mean, that's 1 out of the 100,
So this is a little off topic. Do people ever use it if they have a blood clotting disorder?
Oh, yeah. I mean, really, that's traditionally what their use was any sort of blood stagnation, blood clotting, like, kind of like King Henry VIII gout, varicose veins, like there's stories of Napoleon, how he lost the Battle of Waterloo because somebody hijacked his leech doctor's leeches, and he had a traveling leech doctor with him. But he had a bad case of hemorrhoids, so he couldn't get on his horse and, go into battle and lead his men. Battle of Waterloo lost because of leeches.
Wow, that's fascinating. We hear about it occasionally. I used to work in a hand clinic where I helped with people who had hand or finger amputations that were replanted. And I remember I speak Spanish as well. And so I was an interpreter at the same time. And they put leeches on every single one of his fingers after they replanted his hand to try to get the blood to flow back. And it helped him. My first and only exposure to leeches. And I didn't really think about it so much until I met you. And now I'm truly fascinated. This is great.
It is great. Mm-hmm.
Wow.
And they act like a third vein.
That's incredible.
So
So,
if you have a blood issue like hemorrhoids, varicose veins, you know, you're trying to reattach something that's becoming necrotic, it needs more blood flow, they're great.
so can you go into exactly what they do? So, what is it when they attach to your body, wherever you decide to put them? What
Oh,
exactly do they do to you?
okay. So, you know, I have a different version for when I explain this to patients rather than practitioners, but I'll
Yeah.
give you the, you know, really what they do and
Okay.
not hold back on the scary details.
Let's get it all.
Okay. So they have like 360 little teeth.
Okay.
But when they latch on, their anesthesia already starts injecting.
Okay.
So you do feel like, because you're aware that a leech is biting you, you're like in a clinical setting, you know, you're like, what's going to happen? If you're in the water playing around, you won't feel a thing, you know, but you will feel that it injects its saliva.
Okay.
And I would say on par with mosquito bite sort of sensations. Ooh,
Okay.
ooh, but nothing like, no, I've never had anyone like pleading for their life and yelling and nothing like that. Just some people don't even feel it. But if you do have more of an attention, you know, focused mind, then you will feel a sensation, but I wouldn't say it's like an injection, not even close.
Okay.
So what they do is inject. There are over 100 different peptides, enzyme. I mean, the list goes on.
Okay.
And what they do is draw up, after they inject, 80% lymph fluid, 20% blood.
Got it.
So after that,
Mm-hmm.
the area 3 inches deep into the body and around a coaster size area increases dramatically with more blood flow, less, you know, cellular waste, lymph fluid, you know, they just clean it out like a vacuum cleaner is basically how I like to also make an analogy.
Okay.
They're just little vacuum cleaners that love to clean.
And how long do they stay on?
Well, it depends on where you put them. If you put them in the facial region, you know, maybe 10, 15 minutes.
Okay.
You put them on a lower back, especially someone who has a lot of, you know, stagnation, they may take an hour and a half because they may fall asleep. They may enjoy, like a baby, the whole suckling. I mean, they only get to eat once every 2 years on average.
Really?
They can digest and hold and last for 2 years before they have their next meal.
Oh my gosh, that's incredible.
So it is incredible. Their lifespan is around 10 to 15 years. There's over 650 species of leeches, and only one is commonly used for medicinal purposes. I mean, there's more, but they're not, you know, easily obtained for hospital settings and what have you.
Okay.
So,
do you get them from a certain company or do you raise them yourselves?
No, I do not pull these out of my bathtub or my palm in the back or anything like that. No, they come from a very, very high quality source that is a place in England that's been raising them for over 200 years.
Oh, wow.
So this is like probably where Napoleon got his leeches. Who knows, you know?
You never know. It could be, hey, I'm getting the same treatment as him.
Exactly. And they're FDA approved because they have such a hygiene, you know, process with breeding these medicinal leeches.
Okay. Now, go ahead.
Go ahead. No, again. Go.
So where do you get certified for this? Is this something that's within the country? Is it
nothing? There's no certification here in the United States. I had to go to Moscow. I had to go to Germany. I had to go to Turkey. Like, finding what is going on with these leeches in different countries. They have all their different methods and modalities. So now I feel, because it's so effective and it's so needed at this point in time with all these crazy inflammations and blood clotting disorders because of COVID and I mean, I'm not claiming that it's a cure at all, but it should be in the hands of more people.
Sounds like it.
Yes.
Now, what you do, is it different? Well, I know in an emergency room situation with the hand replant, is it different when an ER doctor uses leeches, and is that more common throughout the country? Do you know?
Oh yeah.
Okay.
I would say every modernized, city has leeches in their,
Okay.
ER. And
Okay.
unfortunately, it's only used for surgical reattachment issues
Interesting.
of venous congestion. If they use it for other conditions, that would be great. But for some reason, that is not kosher with maybe the pharmaceutical companies,
Okay.
or I don't know. It
Got
should
it.
be. I
Yeah.
mean, traditionally, it has historical empirical evidence of being quite effective for a number of conditions, but sadly it is only FDA approved for one specific condition of venous congestion.
Okay. Wow. And so then when you're deciding the body part to put it on,
Right.
do you start with one leech and see if that's enough, or do you kind of have an idea if the area is inflamed, like the size of a bowling ball, for instance, then you
Right.
have an idea how many you're going to need, like 5 leeches or something like that?
Right.
Okay.
Well, so the main difference I would say is that, in a ER setting, when they're trying to reattach, they're just seeing where there's a necrotic area and they're placing it there.
Okay.
So it's quite obvious where to put the leech. But if you're like, for example, not dealing with an abscess or something that's pretty obvious, like where would you place these leeches? What I've found, having, compared what they do in Germany and what they do in Turkey, let's say, you need to absolutely take into consideration the reflex points, the acupuncture points, the trigger points that will make more of an impact in the treatment, not just some willy-nilly like around the area.
Gotcha.
So that's what I know, the big difference.
That makes sense. So a lot of practitioners, or the few that do it outside of the ER setting, do you know if most of them have an acupuncture background?
None.
Really? Okay.
None.
That makes
Not
you
that I
even
know
more
of.
effective.
I would
Yeah.
definitely say, and if you see, like, for example, facial rejuvenation results using leech therapy, there's definitely, other practitioners who would, either put a blood facial on their face alone or in a general area, but by using specific acupuncture points that really release a lot of lymph fluid and activate a lot of blood flow and energy flow, I don't think anyone has gotten the results that I've gotten. I haven't seen that.
That's
So
fascinating.
I'm very excited about that.
So you put the leech right on wherever the acupuncture point is.
Correct.
Okay.
To drain much lymph and promote as much movement of blood and energy.
Okay. Now, when the leech is done, does it just fall off?
Yes.
Okay. That's how you know the treatment is over.
Right. But sometimes, there's a leech that will fall asleep. So you have to wiggle it around. And then some patients have such stagnation that, you do have to just say, okay, it's time, we have to remove this leech. So I use a very simple technique that kind of distracts the leech and we can take the leech off.
That's fascinating. That is absolutely neat. Now, for the patient, is there any aftercare that you have to do specifically to that area after the leech was there?
I mean, that's why I really enjoy leech therapy and why I think people and more practitioners should utilize it in their practices, because the recovery time is ridiculously low.
Really?
Like, say, for example, the number one condition that leeches have been researched for is with osteoarthritis of the knee.
Okay.
So I've had patients who are like, I need a total knee replacement. I'm like, no, you don't. Let's do some leech therapy, because they're afraid of having to maintain the recovery of such an invasive procedure. If it doesn't last, 15 years, 20 years, what are they going to be in a wheelchair? There's a lot of risky things going on there. And recovery time is a big drawback. With leeches, you're looking at maybe 24 hours.
Really?
Of it, having to be gentle. I mean, it is a form of somewhat, biosurgery. You're draining a lot of fluids, most of that lymph, but still, 24 to 48 hours, you can go back to your regular activities without the pain and not have to go get a total knee replacement, and help, promote more blood flow and less inflammation, and you're right as rain. You can go back to work and everything is good. That's incredible.
Yeah, that's incredible. Now, you've treated people with these types of cases, right? With the inflammation and then the trying to avoid the knee replacement. So
Right.
how many visits do they have to come to you to address the inflammation? One?
One.
Wow.
1 hour
1 hour. Wow.
could give a year's worth of relief.
That's incredible.
Yeah.
Very incredible. And can they tell a difference in their mobility as well? Obviously, if inflammation is decreased, but okay.
Immediately. Yeah, because that leech, its body will probably suck up maybe 10 to 15 mLs on average, which is a lot. And if you put a few on there, that's a lot.
That's incredible. Wow. Have you done it on other joints besides knees?
Yes. Shoulders, elbows, knees, ankles.
Mm-hmm.
Pretty much amazed that you can actually do so much work. Like, another reason why I was attracted to leeches is because I was getting frustrated with my needles. And you have to come in once a week, twice a week. No, you really have to come in more. And it was just like, to get results, I'm a big fan of before and after photos.
Yeah.
I'm actually cool. Yes, I love it. So with acupuncture, you don't get that. You have to come in maybe 6 to 12 sessions to really address something chronic. But with 1 hour, you have, I'll see you next year to a patient is so much more gratifying than every other week. Blah, blah, blah.
Yeah. Have you seen any negative effects for having a leech on someone?
I mean, definitely. People who are sensitive to leech bites, like they are to mosquitoes, like they are to, but as that being like the worst symptom is that you have some horrendous itching.
That's not bad.
I don't think it's bad.
That's not bad to avoid a whole knee replacement surgery. That's not bad at all.
No. So I find that worthwhile. I mean, some people have to be more careful than others. Of course, you can't have any sort of anemia, obviously, hemophilia, and you have to make sure that the current medications that you're taking don't have a lot of blood thinning effects because you don't want to overbleed.
Got it. Yeah. Now, if someone is on a blood thinner, do you just have them scale it down a little bit so that way they could still do leech therapy if this is something that could help them with a body part avoiding a joint replacement?
Right.
Is it okay for them to just kind of scale down on their blood thinner, do this, then they can scale back up?
I mean, it's always a delicate sort of process where how much blood thinning medication do they require? If the risk is too high, then maybe, is it worth the benefits? It's always kind of like a juggle. So if I have a patient who has definite need of having blood thinners to prevent thrombosis and, all sorts of cardiovascular risk, I would say, would it hurt not having this for 2 days? If it can be handled, then, the risk of them overbleeding a little, can they handle it? What is their hemoglobin levels?
Okay.
Are they on the border of being severely anemic? Then no. If they're plenty hemoglobin, we're good. So there's different factors to consider: their current medication and what, state their total constitution, if it's weak or strong, is taken into effect.
And that makes sense. And so is there also some psychological coaching that you have to do to get people ready?
Of course. I've had patients with acupuncture for years. And I'm like, can you please just try a leech? They're like, no, woman, you have them here? Do you have them in this room? They're afraid. They're so afraid. So I'm happy that, eventually I break them down mentally to, just be like, come on, it's an hour for a year's worth of of relief. You've got to try it. Stop being such a wuss, and they do it. So that's, yeah, I do have to coach.
Yeah, because, you know, we also have this instinct whenever there's a bug on us, our first thing is to swat it away no matter what. We just have developed that ever since we were kids.
Yeah.
So you see this on you and it's not cuddly and furry and, you know, soft. So there is that, just our subconscious has a lot of, you know, ideas already implanted in it.
Of course.
Yeah. So, okay, so we know joint replacements and we know blood clotting disorders. I'm also curious, Leiden 5, I believe, is a kind of a genetic clotting disorder. Have you used it for that as well?
There's been a lot of genetic diseases addressed with leech therapy, and there's research coming out from Russia mostly, with especially people who have any sort of like lack of flow. So if they have a tendency to build up, you know, inflammation, or one that's really popular is chronic like fat deposits genetically. I'm sorry, I forgot the name of the genetic disorder, but it's basically like fat starts storing into their brains and their livers and they can die. Leech therapy definitely helps draw out the blood fat, the cellular waste, the lack of, you know, flow in many different chronic degenerative diseases and genetic diseases.
Okay, that's fascinating. Are there any other, besides these chronic diseases, are there any other orthopedic conditions that you treat people for using the leeches?
Mostly degeneration, like osteoarthritis, you know, and like thrombosis of like either hernias or varicose veins. Muscle tension, like chronic muscle tension, like from an old injury. Yes.
Okay, and what does it do? How does it help with varicose veins?
So it acts like a third vein. So you take a vein that's bulging and knotted, and you put a couple leeches on it, and the vein is just like a pressure cooker top has been released.
Really?
So then your body is letting go, along with the leech saliva, just pumping as much fresh blood, oxygenating that vascular area, and that valve is just a little bit more nourished from the fresh blood.
Wow. Does it help then, like venous insufficiency? Does it help with that as well, or is that
because it acts like a third vein.
Fascinating. Oh, that's just wonderful. There's just so many ways that you can use this with people.
Absolutely.
And this is incredible. So you also mentioned, go ahead.
This is why, thank you, the symbol of medicine are not mythical serpents. They're leeches.
Oh, that's fabulous.
Yeah, there's no other medicinal snake commonly used in medicine like the medicinal leech. And I also believe this is not something you can check out on Google. Unfortunately, the caduceus symbol has got a different origin, but I believe this is the real deal. Snake oil, also medicinal leech oil.
Not
so
as good
we have
as
all these, you know, historical references. And just recently, back in like the 1980s, we've just started realizing this thing was part of medicine since womankind. Sorry about that.
Yeah, no problem. Wow. So, okay, now you've mentioned it for your face. Please dive in on how we use it for beauty and making ourselves look younger.
Absolutely. I mean, this is the part that I'm like, okay, I can't convince people to really care about their fatty liver condition that, you know, 60% of Americans have. They're like, whatever, I take a pill for my cholesterol or, you know, my high blood pressure. And I'm like, okay. So I had to figure out a way to really give health and beauty in a treatment. And I discovered specific points that will increase such dramatic lymph drainage around the jaw and neckline that I'm so happy that this actually works, because in my life I would have looked so so much older and haggard if I hadn't discovered this technique.
That's incredible. And you do look really young. I don't know your age and you don't have to
Thank
say
you.
it, but you do look very young.
Thank
That's
you.
awesome.
No, I would have like triple chins right now. I would have sagging jowls if leeches weren't a part of my life. Yeah.
Really? And so for a beauty regimen, how often do you do that?
Once every 6 months to a year.
Oh, so it lasts a long time. It's not even that long. And do you do them all over your face?
No, depending on the area. Like say, for example, you have like pooches more closer to the mouth, then that's a different point that you would use. Or you would have like a lot of fullness around the lower, jawline area. Then you would use other points that suck it up like a vacuum cleaner.
That's fabulous. No, okay, so people might ask, what about under the arms or in the hips, stuff like that, where there's a lot of fat deposits? That's more fat, so.
See, yeah, and that's another thing. And that's, I went to countries that did that, like, really? Yeah, but I also learned that there is some sort of there's more sophistication with leech therapy where you don't want to just put them everywhere you have fat, because then you'll have a lot of leech bites.
Yeah.
And dealing with like, little, bite wounds that take a little while to like reduce. So for example, the cosmetic, I use areas like around behind the ear so you don't see the leech bite, and you don't have to deal with like, so many leeches for the most effect by using those acupuncture points.
Okay. This is fabulous. It's amazing. So as you do this, is there an age limit? Can young people do it? Older people do it? Is there a limit on that?
Yes. There is definitely a finesse. And I had to learn through trial and error that not everybody can have, leeches around their neck area without having to detoxify their lower exit areas, so to speak. Okay. So in cases where someone may be like diabetic or have a lot of like, they're elderly and they have a lot of like, they tend to be anemic and what have you, like more weakness situation, then there's a different approach that I would entail. So sometimes some patients need to have more of a lymphatic drainage, like using fire cupping to kind of collect the lymph and toxins to an area, then open an exit area to then help drain the face area. If that makes any sense. Yeah. And that depends on the constitution and the stagnation of each patient.
Okay. Do you encourage people to move then afterwards? Like after 24 hours, you're kind of letting it heal. Do you encourage them to get moving so blood flow is going to that area just to keep the benefits of what the leech provided, keep it going?
Really no need.
Okay. You just kind of let them do their thing, go back to their daily life.
Exactly.
Okay. That's amazing.
Because like, for example, the osteoarthritis condition, they're saying, there's a theory that because it's almost like an empty space, because there's so much degeneration, there's a bacteria that can form and cause an achy red swelling joint. And their saliva also has a very strong antibacterial property that has been patented. I can't even say that word.
I know the word. Yeah.
Patented for industrial cleaning purposes. So by placing that leech there, you're basically detoxifying so much, and that will help improve the blood flow. That will help then regenerate all those tissues. I'm sorry, I forgot what the question was. I don't know where we were with that.
We were we were just kind of discussing about the knees and how it helps people and just in general. But cool. That's fascinating. So with hemorrhoids, how often do they have to, is it again, just once a year or once every 6 months when you have hemorrhoids?
Depends on how bad the issue is.
Okay.
Sometimes people need a full body detox and they need to have more regular sessions with just a few at a time. Because if you put 15 leeches on someone, they might have a healing crisis. So if they're very toxic, which most people with hemorrhoids tend to have a lot of toxicity build up in their colon and their entire lymphatic system, have you. So you would want to make, maybe 1 or 2 or 3 leeches per week for a number of weeks to really address a situation in a gentle but gradual detoxification manner.
That makes sense. Like you're kind of easing them into it so they don't go from one extreme to all the way to another extreme.
Right. But to answer your question, if we did put a leech on the hemorrhoid itself, it would just be 1 session.
Okay.
But to keep those hemorrhoids from coming back, you would have to detoxify the colon in a more gentle, gradual approach.
Got it. Do you also give them dietary advice too, or other lifestyle advice, just because we're trying to get them so they don't have to have this,
yes,
all the time? Okay.
Yeah. So for example, with hemorrhoids, I will definitely delve into not only the diet, which is stop drinking so much coffee and drink water, please. And please have some fiber in your diet, 2 teaspoons of chia a day, no matter what. Those sorts of dietary recommendations. But I also get into the physical or the spiritual aspect of it that has an effect on the physical. So please don't put so many deadlines in your schedule, and don't put yourself in a situation where you're always running late and you're on a pressure sort of mode, So that also is very important.
Yeah. One of the things that I focus on with people is getting them out of fight or flight mode, because it affects the whole entire body. And we don't realize, but what you said with the whole deadlines, just that alone could put you into fight or flight mode. Your muscles tense up, pulls your body out of position. You see it in hemorrhoids, you see it in other organs. It's quite impactful. So we got to slow down our life.
Right. I mean, especially, also letting go. That's another issue with hemorrhoids and what have you that, I address. I definitely get into my patients' overall holistic life, what's going on, what happened to you, to really address ways to kind of avert that from being in.
Yeah. It's amazing. So I kind of just want to touch base a little bit more on some of the other, this is fabulous. If you have anything else to tell us about leeches, and then also wanted to ask you a little bit more about other healing arts that you do.
Okay. Sure.
So please dive in.
I'm so sorry, but I need to charge my phone.
Oh, okay.
I didn't, hold on 1 second. Let me just put my, I'd hate for you guys to have a blank screen in a moment. So
all of a sudden die.
Yeah, exactly. Hold on 1 second.
While you're plugging in, we have one listener who wants to know, how do you do a full body detox?
Good question. You want to start from the bottom up. So there's certain areas that you want to open and make sure that toxins are flowing out. So I would definitely start around the tailbone area, then move up to the abdomen area, and then go to cervical area.
Okay. Well, that's a great question. And do you use that philosophy with leeches as well as other healing arts?
Okay, so I like to combine them all.
Do you?
Because yes, definitely, because leeches have more of an effect on the fluids. If there's a lot of lymph, there's a lot of blood stagnation. Acupuncture has more an effect on the energy. So combining electroacupuncture to really regenerate the energy and the tissues, and then using the leeches to pull out the toxins that are getting in the way of healing. Fantastic. So electroacupuncture is definitely my combination, treatment. I also use injectables of frankincense, dongui, Chinese herbal medicines. Microneedling is another if I have an issue with
electrical conduits. Like, say, for example, someone has a horrible scar. That microneedling will help just release the scar tissue and let energy flow. And that really has an impact on your meridians. And that relates to your organ function and what have you. So I love microneedling. Also because it's another beauty skin resurfacing treatment that if you combine with lifting up this lymph fluid, and then topically, you can't really, the leeches will help, you know, build collagen and give you more of like, obviously a fresh blood, rosy complexion. But what if you have like, you know, aging pores that are opened and not, you know, minimizing quick enough? Or what if you have little fine lines and wrinkles? I got into microneedling as a wonderful adjunctive therapy for, you know, holistic health and beauty, because it not only helps with, you know, beautiful issues, but, you know, scars, which are really detrimental to energy flow.
That's fascinating. Wonderful. And then, so when someone comes in, they can have all these multiple treatments depending on what you decide is best for them. They could have it all in a session.
Yeah, pretty much.
Wonderful.
I don't like to waste anybody's time. And I really like to have that like before and after, like, let's do this so that we can have, you know, one really great session combining, you know, the cupping and then the leech to suck it up and then the electroacupuncture to, like, you know, revitalize and create more form or more function in an area. So yes.
That's
Moxa
fabulous.
is also something I've been getting into.
What's that?
Moxibustion. You've never heard of that?
Mm-mm.
It's basically mugwort,
Okay.
or the Bill Gates Foundation helped fund this Chinese researcher who discovered that fresh mugwort was a great treatment for malaria.
Oh, okay. Wow.
And she won a Nobel Prize for having dug into like a 1,300-year-old manuscript for treating malaria, and it helped significantly save so many lives that would have been lost to malaria. So I love this mugwort, this moxa, as they call it, because they used it before acupuncture needles to stimulate points. So it's like caveman medicine, which is my thing, you know? So right now there's a treatment where you use like a little like rice grain size of burning moxa.
Okay.
And you stimulate points, acupuncture points, but you literally burn and scar the skin. So I
Really
have not done it, but I'm getting into it.
So one of my big things, and one of my principles is, if I'm going to teach someone something, I'm going to apply it to myself first and experiment on myself so I totally understand it. So when I'm teaching people how to breathe differently, position their body, it's because I've experienced hours on end. So are you going to experiment with this as well first on yourself?
Oh, yes. Yes. I've never gotten any tattoos, but I'm looking forward to getting like scarification is what they call it. Scarification moxibustion, festering moxibustion, which I think will look pretty cool. You know, like the benefit of this is that you know exactly where to stimulate your point.
Yeah.
Using either moxibustion, it's kind of like a rolled cigar. Again, afterwards on yourself at home. And there's a project now in Africa helping HIV, helping TB, immunocompromised patients just by the same moxibustion procedure, stimulating every day with moxa your acupuncture points. And then you could also, like in China, see all these older men in all these squares playing chess and showing off their birds with their ankle digging into the scarification moxibustion points. So acupressure as well as moxa.
Okay, that's fascinating. So I imagine you have to have a little bit of practice with this before you start implementing it as well.
Yeah, well, you know, if you know where the point is and you're
ahead. Yeah.
Yes, exactly. and you have a huge informed consent form.
Yeah. Yeah.
Like, they have to realize you're gonna get scarred here. This is perfect.
Yeah.
You know, but it's very small. It's like a rice grain. It's not that big a deal.
Yeah.
But, you know, I'm excited about it because they're using that in China to boost immunity against COVID.
Wow. That's fascinating. I mean, I'm curious then, how many of these points would you have to stimulate or scar to get that full effect, like a full body boosted immune response?
Well, they normally use around 3 or 4 points.
Oh, that's not that many then.
No, it's not that many. I mean, many, but it's basically lung or large intestine 4, which is on the hand.
Okay.
Okay, stomach 36, lung 10, which is on the forearm. Stomach 36 is on the calf. So those are the main points that you can use to stimulate yourself as a daily routine. But other practitioners have also done the mox scarification on the back points for the lung areas. But you can switch it up if someone has like chronic anemia from having not enough liver flow and blood and energy. You can use other points that represent that on the spine and what have you. So it's all fascinating to me how you can stimulate by using this like pre-acupuncture herb at home. It's a little stinky.
Yeah.
I have used it for many years. And actually I had a landlord bust into my practice room yelling, "No está fumando marihuana aquí!" Like my patient having matza burning needles on his lower back and being, draped but nude, like, so it smells like marijuana, yes, but it's not 100% worth the confusion that your neighbors might have if you're burning it in your canopy, outdoor canopy outside.
Got it. That's amazing. So now, do you have a practice? You have a physical practice, right?
Yes.
Do you have a couple in Florida, or one, or how?
I used to have 2 locations, but yes, I'm more, well, also being a mother of 2 toddlers, I'm more into, making it more simple for everybody. So I do a lot of telemedicine. I do a lot of home visits, especially for people who are having, a major leech session. It's best to just, relax at home instead of driving with a huge bandage and draining. Yeah. So yeah, I am very flexible.
Wonderful. So now if people want to reach out to you, because you have many skills and you can help a wide variety of people. So can you tell us how people can reach you?
My website, please feel free to contact.
Okay.
I'd be happy to give anyone a free consultation online, Zoom, Skype, or what have you. I'm here to help.
And your website is gobeyondwellness.com, correct?
Correct.
Wonderful. So people should check out her website, because you can learn all about her and all of her skills. You can read up about her as well as what she does. We really appreciate this fascinating conversation.
It was awesome, Amy. Thank you.
You're welcome. Well, thank you for having us, coming and sharing with us, sharing to our audience, and hopefully you get some new people in your life, because I know you're going to be a resource for me when I have people in Florida or even other places in the country that can talk to you telehealth and get advice. I think it's really good to build that network of people in your healthcare universe to help you out on your journey. So I really appreciate that.
You're welcome. You're very welcome. And hopefully you'd be interested in learning this technique, because if you can help more people over there, the better.
I am actually interested. We'll have to talk about that, because I am always ready to dive into new ways of helping people with health, and just being, having more tools in a toolbox to help people is just one of my greatest passions. So thank you so much.
Likewise. Appreciate it.
Well, thank you guys all for joining us today. We will see you again next week. I hope you enjoyed this amazing conversation. Please contact Dr. Diaz at her website, gobeyondwellness.com. Have a great rest of your weekend. Bye, guys.
Bye-bye.